want to move on and ask you to talk about getting to a place of maintenance and stepping away from the experimenting. Not that you were necessarily in trials, but that the doctors would present options for you to try in an effort to help you manage your condition and get you to a place with minimal symptoms.
And it took several tries, as I think it does for most people. And I feel lucky in some ways to have found some stability with my current treatment, which is pretty simple, of pyridostigmine, also known as Mestinon, and an oral steroid, so oral prednisone. And while that isn't fantastic to be on daily, it's helped me get back to my life. I wasn't able to drive before because of my eyes, so I'm able to drive in the daylight in certain conditions if I know where I'm going. So I've found boundaries with most of the things I do on a daily basis, including my job. So being able to get back to work, not being able to do all the things that I was able to do before, with the main one being surgeries. So I used to perform very intricate surgeries on our veterinary species, on our companion animals, on their eyes. So certainly don't feel confident and comfortable doing that, with both not being able to see well, and I've lost kind of the fine motor skills and the sustainability, or what's the word I'm looking for, with my strength.
I think it's the energy, right? I mean, surgery is time consuming. And if you're not able to maintain a level of energy for that stretch of time, exhaustion can weaken you and just kind of take away, as you said, some of those fine motor skills.
Right. In my job, having to do ocular surgeries that require very fine motor skills over an extended period of time, I would find my hands, arms, and eyes would get to the point of exhaustion and or not being able to feel like I was fully in control of what I was doing, which certainly isn't safe for the patient. So no longer can do surgeries, but I can instruct my residents and students on how to go through these things. So I've found a productive path for myself at work, and again, boundaries at home. I used to be an avid runner, so I would run every day as kind of my outlet. And now I'm an avid walker, which is fine. And my dogs and I have adapted well to walking. It still feels like a loss to not be able to run anymore, but I've embraced what I can do, and I'm very grateful that I could get back to walking, because there was a period of time where I couldn't do those simple things.
I want to move on to the topic of medical gaslighting. So patients diagnosed with MG might feel a sense of relief that they have a diagnosis, but until they get the diagnosis, it can be months, it can be, for some patients, years, and there's self-doubt, and it can impact your self-esteem. It can create depression in how you're feeling on a day-to-day. And I know that you experienced some amount of all of that. And I want to ask you to talk about your experience with medical gaslighting, how that made you feel, and kind of where you are today with your the relationship with your doctor and just the relationship with your disease.
think you said it really well, Michelle, that the doubt that you start to feel when you're perceiving your doctor not completely understanding or maybe agreeing with you on what is going on really creates a lot of self-doubt and very much depression, and wondering not only what is wrong with me, but considering maybe am I making this up? Is this not real? And it takes input from others to say, no, you are experiencing this. I see this. So it was just helpful even for my family and friends to confirm that for me, that they could see what I was going through, and it certainly wasn't normal. And it very much was, when I finally found a doctor who helped confirm what I was feeling and confirmed the diagnosis, for me to actually finally take a deep breath and then think about getting better, not fighting myself and the system, but actually focusing on the future, and instead of feeling so stuck with where I was right then. And so that really created a different, that instant created a different path for me forward in terms of finding the right medical team that could understand what I was going through, understand my life too. So I think it's important that your doctor understands what you have going on outside of MG, and they help you manage your MG within those constraints. And that's really brought me to where I am today. And it is really important for people to not give up until they find that.
Yeah, I think the not giving up is so important. And I want to say to people who are tuning in here that while I'm using the word medical gaslighting can be experienced by your family, loved ones, and friends. And what I'll say is, for people with a rare disease, and MG in particular, there's a lot of education that needs to happen. And that is one way a patient can combat gaslighting. It can feel so insurmountable and also unimaginable that someone wouldn't believe you, especially a loved one. But try to educate the person in hopes that they will understand over time what the disease, what your disease experience is like. Because it is neuromuscular and not always a physical, visual presentation. It can be hard, not to excuse it at all, but education is the point that I want to bring forward.